Welcome back to the Today's Women Show. Thank you for taking time to spend with us this afternoon for your dose of inspiration. I'd like to acknowledge our sponsors at this time: Gino Tomato Mix, Jollof Mix, Pepper and Onion Mix. Gino truly cares. Now, my guest, you're wondering who she is. Just watch this clip, the revelation.
Dr. Zainab Schumacher is a board-certified plastic surgeon and the head of the plastic surgery department at the University of Ghana Medical Center, UGMC. With over a decade of experience in surgical practice, she is widely respected for her expertise in reconstructive and cosmetic surgery, as well as her leadership in advancing plastic surgery in Ghana. She holds dual fellowships, Fellow of the West African College of Surgeons and the Fellow of the Ghana College of Physicians and Surgeons. Dr. Schumacher has served in several public hospitals, including EA Regional Hospital and Komfo-Anokye Teaching Hospital, bringing care, precision, and compassion to every patient she treats. Since 2021, she has led the plastic surgery department at UGMC, where she combines clinical excellence with administrative leadership and mentorship of younger surgeons.
Let's welcome our guest. Hello, Dr. Zainab. Welcome to the show. I love to give hugs, so please have a seat.
Thank you.
A fine plastic surgeon like yourself. So welcome to the show again.
Thank you for having me.
Thank you very much for allowing or agreeing to come and sit with us to chat this afternoon. So a plastic surgeon, eh?
Yes.
It seems to be kind of like a branch of medicine that you don't hear very many women going into.
Not really. Maybe in Ghana or maybe in our...
More like in our culture, I would say, yes.
Yes, in our culture. But I mean, surgery is not something that you have a lot of women going into in general. And plastic surgery is also a relatively young specialty. So maybe that's why you don't hear about it, unlike the other well-established or popular
branches of medicine.
Yes.
So did you train in Ghana?
Yes, I did.
100% Kolibu or they were trained?
I trained in Kumasi.
Okay.
Komfo-Anokye Teaching Hospital.
Okay. Okay.
Yes.
What made you go into plastic? Why did you choose that branch of surgery?
Plastic surgery, and my interest in plastic surgery actually started when I was in secondary school, Wesley Girls.
Okay. Wege hey.
Yeah. And I mean, during the vacation, I had a dissecting set, so I used to practice with frogs and
really? A young lady would be playing with dolls and stuff. You were dissecting frogs.
Yeah, I mean, it was interesting. So that's really where surgery came in. But plastic surgery properly, maybe in my later years, the beginning of medical school, you know, most people think plastic surgery is all cosmetics. And really that's what drew me to plastic surgery. I realized that it was a wonderful transformation. You see the wrinkles disappear, the breasts are upright, all of a sudden the person looks fit and very curvy. But I mean, when I started training, I realized that it's far from that. But it's also quite intriguing because plastic surgery encompasses the whole body from head to toe and all ages, from newborns to the very old geriatric.
Yes.
So it's quite interesting. You are not restricted by a body part or an age. You see all, I'll say all walks of life, all manners of life. So it's really interesting. So that's really what I'll say captivates me and keeps me
going.
Yeah.
I mean, for me, I think my first encounter with what was plastic surgery here in Ghana was actually at the plastic surgery and reconstructive surgery. So when you talk about the fact that plastic surgery in Ghana encompasses a lot more than just the beautification, the beauty aspect of it is more about keeping people confidence and giving them what they require to be able to, you know, face life on a daily basis.
Exactly.
But you just said that you've done the whole spectrum for me. You've seen literally almost everything. What's the wildest surgery you've performed?
The wildest surgery I'll say is maybe just last week. Was it last week or last 2 weeks? My colleague and I took out a super huge mass on a young boy's thigh. It was a cancer anyway, a sarcoma. And at a point, he had been all over, and people had been tossing him up and down, saying they would amputate, he would lose the limb. But me and my other colleague, who is also quite adventurous, we decided to do it without having to chop off the leg. And God being good, we were quite successful. And I mean, at a point, everybody was like, is the guy dead? Is he still alive? Is he dead? Like, he really lost a lot of blood, but I say we came out successful. It was a really successful.
How long was that surgery for?
About 6 hours.
Wow.
6 or 7 hours.
So when they say somebody's been in surgery for that long, do you ever take breaks in surgery? Or it's just standing on an individual, over an individual, carving them up for that long?
Well, you know, when you are in it, sometimes you lose yourself. You don't even realize time going by. And sometimes it depends on the particular surgery that you are doing. Sometimes, even though, you know, we always have like an assistant and then the surgeon, but we could be two surgeons who are like two specialists at the same time. Maybe you are not doing much, it's a long surgery. You can just take back, maybe have a cup of coffee or eat something and come back. But for the most part, we are there throughout.
Constantly on that.
Yeah.
So did you have your parents' support when you decided to go into surgery?
Oh, massively. I'll say that they are one of my biggest fans. Yes, and I mean my husband too.
Yes.
But remember, my parents were super supportive, right from medical school, going through the training. You know, my parents live in Accra. I mean, I was
born and raised in Accra.
I was raised in Accra.
Okay.
I wasn't born in Accra, but
you were raised in Accra.
I was raised in Accra. Then I went to Kumasi for school, and I remained there for my specialization and my specialty until I got married. I mean, I've been in Kumasi, but I mean, my parents, they really helped me throughout with care of the kids, especially. Sometimes they take them off you for some time. So they have been super supportive, and I can't thank God enough for them in my
How many
life.
children do you have with your...
They are two, a boy and a girl. It's 10 and 8.
Oh, wow. You don't look like somebody with a 10 and 8-year-old. You look like somebody just finished their housemanship last year.
Oh, no.
No. But do you think that you felt the pressure to prove yourself against your male colleagues at any point?
Being a male-dominated specialty and training, yes, it's quite tough. And in the beginning, I'll say that normally the people will expect about 200% from you, the female, than 100% from the male.
Even in this day and age?
Oh, even in this day and age. I mean, we are still in the minority, but thankfully, we have a lot more people in training these days. So I'm sure in the next few years, there'll be lots more
female women
in surgery. Yes.
But
even though it had been tough, I'll say that where I trained, they were also really supportive, and they really made my journey easy. I mean, maybe they said some stuff behind my back,
but you didn't care.
That's their problem. But yes, they were really supportive, and yes, they helped me through. All in all, you need to be resilient and really have a thick skin. You hear a lot of things and people will pass petty comments, but You must be focused on the goal.
It's always a human institution, and
Yes.
you'll always have those people.
Exactly.
The naysayers will always be there. What do you think, in your opinion, is the biggest misconception people have about plastic surgery?
To begin with, I'll say that people think that plastic surgery is all about cosmetics and making people look pretty and beautiful. But that's the biggest myth, because plastic surgery is actually in two fields. We have the reconstructive surgery and then the cosmetic surgery. And the reconstructive surgery, that deals with restoration of form and function. So the aim of reconstructive surgery is not necessarily to look beautiful, but for the body parts to function as it is supposed to be. So if it's a hand, whether some parts of the fingers are gone or not, it should function as a hand. And of course, with the cosmetic surgery, they are well up and good. They just feel like
There are too many wrinkles on their hands, so why don't we just put some fillers in there to make them look youthful, etc., etc.
I'll say another myth I would say is the fact that people think that if you do plastic surgery, you die. It's not safe. But that's not true.
As in the cosmetic?
Yes, as in the cosmetic, yes, the cosmetic surgery. But once you go to a well-qualified person in a recognized setup, you should do just fine. And another myth is probably people say that plastic surgery is just for women. But we have a lot of male clients and patients at both reconstructive and cosmetic. So plastic surgery is for both. And plastic surgery is not just vanity surgery. It's also the surgery that is done to boost your confidence as well.
You just mentioned about men. I can understand the reconstructive surgery, because I think reconstructive surgery, like you said, is supposed to put whatever member of your body or whatever part of your body to the optimum use of function.
Yeah.
Why would a man want plastic surgery?
I mean cosmetic
surgery.
Yeah. Just as women want cosmetic surgery to boost their self-esteem and make them look pretty. The same with men. I mean, a lot of them have been going to the gym and all, but they are not really quite there yet. They just need a little boost. And we help them, plastic surgery. Some people have breasts that they are insecure about.
So you remove them?
We remove them for them. And some people want abs or arms, fake arms. We do all that for them.
I don't want to come up here, but I don't want anybody to come for me on my opinion of plastic surgery. Hey, do you know what I mean?
Yeah, exactly.
But I mean, for me, it's just one of those things I think about. I think these days, literally, beauty clinics, aesthetic clinics are they've got either giving infusions or they're giving fillers or they're giving Botox or whatever it is that they're giving. Are there no side effects to that at all? Or may I just sort of add as well, what is the difference for somebody to know between a filler and Botox?
This is a very good question that you've asked. Actually, I really like your preamble about saying that all these beauty spas and things are all doing that. First of all, you shouldn't let anyone who does not have some form of medical background inject anything into your body. There are lots of people in town these days, even hairdressers and all, that are injecting all sorts of things, and it's really dangerous. And we see the complications also, because they come to us, finally they find us.
But would you give them the fillers and the Botox?
Yes, we do all that. It's all part of our job. So back to your question, the difference between fillers and Botox. They are very two different
substances.
Yes. Botox is a chemical. It's a toxin that we inject to paralyze the muscles normally. So they come in very little doses, and you must be really, really sure of how much units that you are using, based on wherever. And really, Botox, you can use it not just for the face, for wrinkles. We use it for migraines. We use it for
and excessive sweating and things like that.
Excessive sweating, yes. Some people have these anomalies of their eyes that rapidly move. Yeah, we can also use Botox for that as well. And even some people that have some gynecological dysfunction, we can also use Botox
for that.
To create. But fillers, on the other hand, are to achieve volume or increase whatever it is in size. So you will notice that the fillers, they are like gel-like consistency as opposed to Botox that is liquid. You even barely see it even in the syringe. The fillers, depending on the type of fillers, but generally they have a gel-like consistency. So either you are plumping your lips or having fuller cheeks or
getting rid of your whatever lines they call
the nasolabial lines.
Yes.
Yes, all that is with fillers. So fillers are, as the name suggests, to fill, like they are to give volume.
But why do I have to keep going back every 6 months?
Because fillers, unfortunately, and sometimes we call them liquid gold, because they are so expensive, but they don't last long enough.
And are they safe?
Yes, they are safe if they are done properly. Because in the injection of the fillers, the person, that's why I say you must go to a medical person,
professional,
who knows the anatomy of whichever area they are injected, because they are blood vessels, they are nerves. I mean, once the fillers hit these areas, and it's really dangerous for you, but they are safe if
fairly safe.
Done properly.
What's your definition of beauty?
For me, beauty really is from inside out. Yes, you must be beautiful inwardly to be beautiful outside. And beauty is really what other people perceive of you, your appearance and your demeanor. Not just the shape of your nose or, or how thick your lips are or how small your waist is. Yeah.
How do you handle requests that don't align with your personal ethics?
It can be tough, but normally, if it's something that I don't want to do or I'm not comfortable with, because sometimes some people have really outrageous requests.
Tell me one, like an example of one.
Someone comes to you with a photograph of two different people and says, oh, maybe I want Jennifer Lopez's nose and Kim Kardashian's lips. You can already see that this is a troubled person. This is not someone that you want to deal with, because more often than not, they are not happy with the results that they get, and they keep coming back. This is what we say, person becomes an albatross on your neck. So normally, I'll talk to them, first of all, what's motivating you, what's making you come for this procedure or for surgery. And I try to appeal to them. For some people,
if you don't do it for them, they'll go somewhere else.
Exactly. So for some, I refer to psychology.
Okay.
To
talk
have
them
an
to
input.
counsel. Yes.
But like you said, as human beings and adults, there's something. They decide they want this. If you can't do it for me, yes. So they shop around a lot too. So they will go until they get the procedure they want.
How do you see the recent rise in the influence of social media on beauty standards, especially on the younger generation?
Yeah,
I mean, there are even older people like my age who are still very, very influenced by what they see on social media.
I know. Even my little girl, who's 8, sometimes comes to tell me stuff about like, what are you talking about? Yeah. But social media, it has come to stay, whether we like it or not. And it does have some positive sides. Like, you could get some really good education about beauty and beauty products on social media. But at the same time, there's a lot of fake in social media. There are a lot of filters, there are a lot of photos people don't tell, there are real stories. And people say all sorts of things. People have had surgery, but they say they've been to the gym. And the deception, So, I mean, if you follow social media, you must do so with caution. And you should know that a lot of what they are saying, a lot of it is cooked up.
The funny thing about it is watching shows, as we used to have, is it Beverly Hills 902, one of these things, Dr. 90210 or whatever it was. So where you see somebody and you don't realize, you see them just before they have the surgery, you see them the surgery, you see them one day post-surgery, And then you see them 6 weeks
After.
later.
Yes.
And then you think that
after.
is so easy for them.
Exactly, yeah. So I always tell my patients and my clients that, because a lot of them have researched before coming, I said, oh, what you see on social media is not immediately after. Because the recovery journey can be tough.
I mean, I had a friend who had, here in Accra, she did a tummy tuck. And watching her during over recovery, I asked myself, why does one want to do that to themselves? Yeah. But you know, some people, I have very low pain threshold. I'm not going to try and fix what's not quite broken yet. So what's the legacy you'd like to leave, or you hope to leave in regards to your field of medicine and beauty?
For me, my biggest legacy I would like to leave behind is the impact and the change that I would have brought in people's lives by way of healing, and also having nurtured and mentored a lot of young ladies into the field of surgery and plastic surgery, and actually medicine in general.
What would your message be to young women who look in the mirror today and feel, I'm not enough?
When you look in the mirror and you see yourself, you should know that you are unique and you are magnificent. You are not a mistake. You are still a work in progress, and you are still evolving. And nothing defines you like how you define yourself and how you perceive yourself. You are not defined by the size of your waist or what people think about you. At the end of the day, you should have self-love and confidence in yourself.
Yeah. We have to work with it. We are all points of inspiration.
Yes.
So I think that, you know, thank you for the ladies that you brought along and inspiring. I guess for all of us at home and stuff, if you know a young lady, you know, beauty is something that we need to nurture. Beauty doesn't mean that I have waist 26 or whatever it is, hip 44, and you know, and that's not what beauty is, like you said. And I like that. Your definition of beauty truly is beauty. Beauty has to be inside, radiating on the outside. Thank you very much. Thank you for sharing your story, but I'm not letting you go yet. I'm not letting you go. We're going to go for a commercial break. And when we come back, we have a game we play here, and which is the quick fire round. I'm going to ask you 5 questions, and you've got to sharply respond to those 5 questions. Okay? Sure. Viewers, please stay with us. We'll be right back. Welcome back, viewers. My sponsors for the show are Gino Tomato Mix, Gino Jollof Mix, and the pepper and onion mix from Gino. Gino truly cares. So now, I'll call you Zainab. I think that the formality for the doctor and the missus at the end of it, I beg you. Yes. Let's do it. Quick fire, quick questions. A woman in medicine who inspires you?
Professor Efwa Hesse.
What does she do? What is she?
She was Ghana's first female pediatric surgeon.
Oh, that's lovely.
Yes. And she also went to West Girls.
And she also went, I mean, these people are champ. Me too, I'm Akora, okay? Me too, I went to Achimota school. These West Girls people come and sit on our head. Please, I beg you. Your most misunderstood cosmetic procedure?
Liposuction.
Why do you say that?
Because most people, or most of our clients, when they come, what they say to be liposuction is completely off. They confuse it with a tummy tuck, with a BBL, I mean, with liposuction proper. So it's the most understood.
What is the downtime for liposuction?
The downtime?
Yes.
Depends on what you do and how much you do.
Out.
I mean, if you are just taking your arms or just your inner thighs, the downtime is a few days. But if you are doing full body, front and back.
Yes. Mommy makeover.
Yeah.
That's
mommy makeover is not completely liposuction.
Because there are tummy tucks and things in there.
Yes, and
the breast and lifts and
so
stuff like
the
that.
downtime will be longer.
Yeah.
So maybe like 4 to 6 weeks.
What about, how expensive is it to do the lipo, for example?
If it's only liposuction, again, it depends on the body parts. If it's the abdomen or the back, or you are doing everything, or you are doing all your limbs, or you are going to transfer the fat, where we call the BBL, or even nowadays you can also transfer it to the breast. So that will all be inclusive in the price. But I mean, expensive, they say, is relative. So to give you a figure,
no range,
like a range.
Yeah.
If you wanted to do just liposuction of your abdomen, front and back, then you'll be looking about 35, 45,000 cedis if you are relatively small build.
Okay.
Yeah.
Well, I mean, there's something that I didn't speak about, which was the BBL, but I'll catch you on that another time. One health tip you swear by?
Hydration.
Ah.
Yes. Hydration is really important because it keeps the cells plump.
Okay, and what do we use to keep our skins hydrated? We're not about drinking water internally, but how do we keep our skins hydrated?
Our skins hydrated. I use hydrating moisturizer, but any moisturizer normally
water-based
would help. Water-based with sunscreen. Okay. Yes. Nowadays there are even water-based sunscreens as well.
And it's very important for us to wear sunscreen, isn't it?
Yes.
We underestimate the damage of the sun rays.
Yes, because most people think that as black people,
what am I wearing sunscreen for? Exactly.
Yes, but you can really get sunburn. Sometimes you feel some pain on your face that you don't even know where it's coming from.
And that's
a sunburn.
Wow.
Yeah.
But I guess we are dark already, so a sunburn doesn't show. A beauty trend you love or you hate?
Love Botox. Hate cool sculpting.
Ooh, and there are a few companies doing that now?
Well, that's just
no comments. One word every woman should start her day with.
Worthy.
Worthy.
Yes. You are worthy.
Beautiful.
Yes.
Beautiful. Now we're going to invite our model on set, and you're going to tell us about your morning routine. So we have Ruth in the hot seat, and Zainab is going to do her morning routine on Ruth for some of you at home to see what keeps her skin looking so glowing.
Thankfully, I have been blessed with good skin. So basically what I do is to maintain my skin over the years. And my skin is a little bit dry, so I'm more for the hydration. Most of my skincare routine has a lot of hydrating stuff in it because I've got dry skin. So we started with hydrating cleanser that we'll use, and then we've washed her face already. And when you wash your face, it's important that you take your time. And it's your morning routine, it's your time to yourself, the 2 minutes to yourself. So you take your time and then you wash your face in nice circular motion. And then after you rinse, and then you pat dry, either with a towel or paper, like for the kitchen roll or that kind of paper. And then you wait for it to dry. And then normally I apply a toner, but I don't use a toner every day, maybe once a month or once in...
Why?
Everybody and their needs. What the toner really does is just to sort of get rid of hyperpigmented areas. So if the hyperpigmentation is not really a problem, then you don't need to use a toner every day. Like I said, this is my skincare routine. Some people feel like they should use a toner every day or every 2 days or every...
So yours is your preference?
Yes, so this is my preference.
Okay.
So we use the toner, sorry Ruth, it's just...
So the direction that we clean our faces or we put cream on our face is very important, isn't it?
Yes, so...
Because we're used to like doing this.
Yeah, normally. So normally it's preferred that you do them in circular motions towards the outer sides of the face. Yeah. So once you put the toner, you wait for it to dry. Like I said, you have to be patient. So maybe after each step, sometimes just say something in your head, maybe A, B, C, D, E, or you go over your to-do list for the day.
Or if you have a handheld fan, please use it.
You can, yes, for it to dry.
Yeah.
Then after that, I use a vitamin C serum. And what the vitamin C does mostly is brightening. That's the main thing that the vitamin C does. But it also helps to with the collagen in the skin. So the most just a few drops on the face. Sorry. And then, sorry.
Let me be your assistant.
And then you should let it also set in and dry. Then I follow on with my moisturizer. So like I said, I have dry skin. So what I use is a hydrating moisturizer. It's a water-based moisturizer.
This is all part of the self-love, isn't it?
Yes. So this is your time to yourself.
Me time.
Yes. So normally, whilst I'm doing this, I'd be going over my to-do list and thinking about planning the day. So once this is done, then we'll always end with a sunscreen. Yeah. And this is also water-based because I'm very big on hydration.
So there's this thing about sunscreen being the length of your 2 fingers. Is that true?
No. I didn't go by that. Otherwise,
you
create
a white cast. Yeah.
Yes. Sorry.
And this thing, like we're talking about sunscreen and moisturizing your face and using the vitamins, is there an age limit? I mean, in terms of must I be X number of years before I start looking after my skin? Or, you know, a child who is like 20, 21 can be doing the same routine as you are?
As we age, of course, our skin needs are different.
More.
And I mean, they will change because younger teenagers probably just need a moisturizer and sunscreen.
Good moisturizer.
And they are good,
Okay.
yes. But of course, as you grow, you need to maybe add in a little bit more retinol or azelaic acid or other things, depending on, because we also have sun damage from the environment and aging. So your
needs are different,
and your products
are
will be
different as you grow older.
So essentially, that's my morning routine, and as you can see,
she's glowing already. Hey Ruth, you're glowing already.
Yeah.
So viewers, I guess you enjoyed the little activity between Zainab and Ruth. And like she said, you do not need to be of fairer complexion to start wearing sunblock. There are lots of products on the market. Research before you buy them as to which one suits you best. Some of them leave a white cast, some don't. Some are water-based, some are oil-based. It's actually your preference, really,
Yes,
and what's good for your skin. So, Zainab, thank you so much for being on the show.
Thank you so much.
I'm going to look you up.
Me. Oh,
I'd
please
rather
do.
come to a medical doctor for any beauty interventions. I mean,
Yes.
do you think I need anything? Well, I don't know yet, but we'll see.
We'll
So
see,
I will
yeah.
certainly be in touch, and thank you
Sure.
so much for your time here today.
Thank you so much for having me.
Wishing you all the best.
Thank you, and you too.
So guys, World of Trendy, stay tuned.
Every stylish woman knows true beauty begins in the mirror, not with makeup or clothes, but with the words you speak to yourself. Here are 7 affirmations and confidence tips to help you walk boldly into each day. 1. I am enough. Stop comparing. Your journey is yours alone, and it is worthy. 2. I am powerful beyond measure. Speak up. Your voice is valid, and it deserves to be heard. 3. My body is beautiful and worthy. Wear what makes you feel amazing. Style is your personal signature. 4. I'm allowed to take up space. Stand tall, make eye contact, show up fully because you belong. 5. I rise every time I fall. Confidence isn't about perfection, it's about rising stronger. 6. I attract peace, love, and opportunity. Protect your energy. Let your light be calm but undeniable. And 7. I shine my light unapologetically. Don't shrink to fit in. Your brilliance gives others permission to rise. So go ahead, talk to the woman in the mirror with love, power, and truth. Because confidence isn't something you find, it's something within you.
Welcome, guys. I'd like to acknowledge our sponsors as always. Without them, I wouldn't be sitting over here. So, hey, Gino tomato mix, Gino jollof mix, pepper and onion mix. Gino truly cares. Now it's the final part of the show, the woman on the move. Be inspired.
My name is Chantel Kukwa Igan, and I'm the founder of the Art Sphere, formerly known as Arts and Cocktail. And I always say that I'm in the business of making people happy. So at the Art Sphere, we curate art experiences for individuals, corporate companies, couples most especially, to bring happiness through sharing their creativity by painting and sipping on some cold drinks while bonding with their friends creatively. What inspired me to start this business was my time in school. So I studied visual arts in SHS, and in university I studied performing arts. But I always found my way back to my paints and my brushes. And when I started to rekindle my love for art, my friends in my hostel also wanted me to teach them the painting. And as a student who always needed, passive income, I decided to teach them for a fee. So I partnered with a restaurant to host these experiences, and my friends would actually pay to experiences, and that is how it started. And one thing that inspired me to keep going was my love and passion for art. Ever since I picked the brush, I never put it down again. So a typical day in this studio is opening the studio ahead of time. So we have our opening hours at 10 a.m. to 6 p.m. from Monday to Friday. But when I open, I come here at 9 a.m. after I drop my son off at school. So at 9 a.m. I check if the cleaner has cleaned the place very well. And then I turn on gospel music and then pray over all the 3 spaces and then commit the day into God's hand. Then I go over inventory, then I pack orders that are supposed to go out for the day, and then I do administrative work like income and expenses, making sure I know what has to be restocked and what doesn't have to be restocked. And basically, if someone has a booking and the person comes in for a paint session, we host the person in the paint session with drinks, painting, and then at the end of the day, I pick my son from school and then he comes home, we do his homework. If he's in the mood, he requests to come to his studio to make a painting. If he's not, then I make dinner for him, and then the day ends and the cycle repeats itself. As a female entrepreneur, I'll say that being in a space like mine, first of all, art is usually associated with men. But being a woman who is deciding to challenge the status quo, I'm starting to host sip and paint event, have a business surrounded by art, promote art through hosting these experiences. First of all, I'm not only challenging the status quo as a woman, but I am also in a very niche community. We know in Ghana, art is still a process it's still a process of people beginning to understand what we do. So being in a business like this, which is very niche, the challenge is every day is a challenge. You have to keep promoting the business. You have to keep educating people to understand what you do so they can buy into your concept. And what are some of the surprises I face every day in this business? Every day is a surprise, to be honest. Every day is a surprise. You never know what is coming, and you just take on the surprises and then overcome them daily. My vision for the next few years will be to be a leader in this space, to be a creative company that keeps promoting art, keeps hosting unique and themed experiences for people. I want to be noted for what we are already noted for, but I want to thrive in the corporate space as well as hosting unique experiences for both individuals and couples. So being an entrepreneur is not easy. I haven't found someone who has actually said being an entrepreneur is easy. But to stay motivated every day, you need to be your own motivation. You need to wake up in the morning and realize that nobody is coming to motivate you because you chose this path on your own, and the path can be lonely, but it also can be rewarding. So on a tough day, you need to stay motivated, read your Bible, look for books that help you stay motivated, and also be your own cheerleader. There are days where this place is empty and there are days where this place is very full, but it all depends on your consistency for the business. So staying consistent, keep posting, keep being your own motivator. If you can't post your business, if you don't post your business, no one is going to post it for you. Promote yourself, promote your business, and stay focused and consistent. The advice I'll give to young ladies starting out would be to take your time. Take your time and don't jump into entrepreneurship like it's your breakthrough for financial freedom. To be honest, I was always motivated and passionate about art, but how it started was I decided to build a community of people who loved doing art as fun on social media. So I built a community on social media first, where we'll host these pop-up events at restaurants even before securing a place. So lucky for me, I inherited this place from my family, so I don't need to pay rent. But one thing you find is most people associate being a CEO, putting that tag on themselves, with owning a building. You can run a successful building by operating it online. So don't jump into owning a space so quick. You need to build your following, build your community, build your customers. And when there is a need to expand into a brick and mortar, you do that. Entrepreneurship is a journey. It is not a race. Be slow but sure, and then you get to the point.
I hope that was truly inspiring. Please don't forget to watch us next week. We have more stories that will keep you enthralled. And you've taken a dose of inspiration from Dr. Zainab's story. And we'd like to say thank you to her for sharing her grace, wisdom, and commitment to promoting safe and empowered beauty. Always know that true beauty comes from within, and that taking care of yourselves or ourselves is a deeply personal and important choice. Whether we choose to focus on inner growth or physical transformation, it is essential to prioritize our own well-being and self-love. Until next time, never forget, you are called, you are capable, you are today's woman.
Today's Woman is brought to you by
Gino Pomo Tomato Mix.